Laura and Sam, thank you for taking part in that, Laura. I'm Emily and I'm going to run us through a debrief. So initially, I just wanted to ask you, Laura, how you feel that went.
Okay. I think it was a bit challenging, but I think okay.
Okay, great, thank you. So let's just talk about a little bit about sort of what happened and what I observed. So I noticed, Laura, that you sort of did your AT assessment and verbalised that you found a news of 5. And then you sort of asked Sam for help, but in the duration of the scenario, this patient wasn't seen by the doctor, and that concerned me a little bit because this patient was septic and needed to be seen quite quickly to prevent them from getting more unwell. And I wondered whether we should just talk a little bit about sepsis and what sepsis is. Sam, would you be able to just share with us just sort of a brief summary of what sepsis is, and then we can sort of relate it a little bit to this patient?
Yeah, sure. So, I mean, Laura, sepsis is a medical emergency, and it's one of those things where somebody has an infection and it causes like a systemic response, and these patients are really unwell. They need treating quite quickly with antibiotics and fluids, and you need to take some blood tests, and this is all quite time critical. So, I mean, seeing the fact that this patient had a high news score, we need to really be urgently getting this patient assessed by some of the medical team, so that we can treat them as quickly as possible.
And what helps us with that, thank you Sam for that, is so you accurately calculated the news of 5, and I don't know, are you familiar with this escalation pathway, something? Yeah. So as you can see, sort of with a news of 5, then you need to inform the doctor immediately, which you did do, but then they need to have, sort of, as Sam's explained why, a really rapid assessment within 30 minutes. And Sam's response was kind of, he might be up to an hour, if not more. And in that sort of duration, this patient would have got worse. Would you just talk us through what made up the news of 5? So what were the odds of this patient? Do you remember?
Yeah, they had a low blood pressure, and they had a high heart rate, and they had a temperature.
Yeah, so and all of those are really sort of key signs of sepsis, and sort of what indicated that were those worrying signs. And so this patient would have needed to have been screened for sepsis, and then as Sam explained, we need to be really straight onto kind of thinking about our sepsis 6. And doing that quite promptly. Are you aware of what the sepsis 6 are?
Yeah.
Okay, great. Would you mind just sharing those with the group? We can do it together.
Yeah. So you free out, free in.
Yeah.
And
yeah.
we take a lactate, and we take blood cultures, and we test urine, and we look at the fluid balance as well. So is someone passing urine, and then we look at free in, so giving someone fluids and antibiotics and oxygen if they need it.
Yeah, great. And this gentleman's oxygen levels were actually okay, weren't they? Okay, great. Did you have any questions or anything you wanted to ask, Laura? No? Okay. Anything else you wanted to add at all, Sam?
I just think it's worthwhile reiterating that this is, these patients are really unwell, and so making sure that they get treatment quickly is really important.
Yeah, great. So I think sort of our take-home messages, what the learning objectives of today was to kind of recognise the deteriorating patient, and escalate appropriately, and kind of that having that confidence to step up and speak up and challenge any sort of difficulties you have in that escalation, because it is so important for these patients to be seen. So great. Thank you very much.